Good afternoon, everyone. My name is Yemi Gautier. I am a management analyst with the Department of Healthcare Finance. I work under... Yep. Okay. Okay, how about now? Let me project. Okay. My name is Yemi Gautier. I'm a management analyst with the Department of Healthcare Finance. I work under the Division of Eligibility Policy. So we do all eligibility policy. I've worked with a lot of y'all, so it's great to see some of your faces. Today I'm going to be talking about the Medicaid unwinding and the Alliance and Immigrant Children's Program renewal restart. So quick overview of what we'll be talking about. I'll be talking about the Medicaid unwinding update and the federal public health emergency extension, our unwinding efforts with the completion of Medicaid renewals, our planning focuses, for operational plan, policy review and changes, and system readiness, immediate actions to encourage Medicaid and Alliance ICP beneficiaries to update their contact information and communication plans.
Can you explain what ICP is?
Sure. ICP is Immigrant Children's Program. It's the district's locally funded program that provides health coverage for those who are not qualified for Medicaid or who are not qualified for Medicaid. Okay, so a description of the federal PHE and return to normal eligibility operations. The federal PHE, which stands for Public Health Emergency, if you don't know, which governs the Medicaid and CHIP programs, are still in effect. States have received a 6.2 enhanced match funding to provide continuous eligibility for beneficiaries. So that just means that we've been maintaining coverage, and the only time that we have discontinued coverage were under 3 circumstances, which were for death, no longer being a DC resident, and under a beneficiary's request. On July 15th, the Health and Human Services issued an extension for an additional 90 days for the federal PHE. So our new extension expiration date is October 13th, 2022. The Health and Human Services has committed to providing states a minimum of 60 days advance notice before the end of the PHE. If the PHE were to end on October 13th, 2022, states would receive notice by mid-August. The unwinding of the federal PHE means a return to routine eligibility operations that would require states to complete renewals for all Medicaid beneficiaries before taking adverse action, otherwise known as termination. Agencies may terminate coverage for beneficiaries who are determined no longer eligible for Medicaid or do not return requested information, such as requests for information or renewal forms. States have 12 months to initiate all renewals and 14 months to complete. The Center for Medicaid issued a state health official letter on March 3rd, 2022, that was an update to a previously issued letter on August 13th, 2021, explaining the unwinding planning with a focus on 3 key areas. The first one being describing how states may distribute eligibility and enrollment work to restore routine operations, mitigating churn for eligible beneficiaries, and promoting smooth transitions of individuals between coverage programs, including Marketplace. States will have 12 months to initiate all renewal redeterminations. Guidance allows for an additional 2 months to complete all pending actions initiated during the 12-month period for a total of 14 months. So our initial planning focus is our operational plan, policy review, changes, and system readiness. It's a little small on my screen. So our first piece is states must establish an unwinding operational plan, solicit input from managed care organizations and other Medicaid partners. We will review and update current policies and procedures, verification plans, E14 waivers, and decide which flexibilities to retain or adopt. Eligibility enrollment changes, enhancements to ensure system changes are ready for full functionality during the unwinding of future determinations. What does this all mean? Essentially, we're going to communicate with our partners, make sure that our system is prepared to take on the changes that we're going to see during the unwinding, and make sure that we're able to transition our beneficiaries between programs or the marketplace if they're no longer eligible for Medicaid. So one of our big district focuses right now is to encourage beneficiaries to update their contact information. They can visit District Direct to update their contact information to make sure the communications are sent to the correct address. District Direct is a website and app that district residents can go and log into to complete their renewal, report changes, submit verifications, and review notices online. You can visit districtdirect.dc.gov or download the mobile app through the Apple Store or Google Play. This is a really big, important point for our agency at this time. We haven't been in contact with some of our beneficiaries since before the pandemic. And we know that even before the pandemic, people move often, and even during the pandemic, we have expected that many people have. So to make sure that there isn't any unnecessary terminations and people are receiving their forms and notices, we're really encouraging all of our partners to get the word out that beneficiaries update their address. So our district focuses to encourage beneficiaries to update their contact information. We have outreach and communication contractors. We're going to hire a contracting team to help us with our communications through the district to make sure that everyone in the district is aware of our current status with the PHE and our future plans and what next steps they'll need to take. We're going to have a communications and education campaign, district-specific unwinding communication toolkit. So basically just outlining what the district specifically will be doing to unwind from the PHE, advertising plans, and community outreach plans. So now I'm going to shift gears to our Alliance and ICP renewal restart. So an overview of this section, we're going to talk about the Alliance and ICP renewal restart, changes to the program for MAGI methodology, additional Alliance changes, an overview of the Alliance and ICP eligibility requirement and verifications, the Alliance and ICP renewal process, and ways to complete and submit Alliance and ICP renewals. So the district's public health emergency ended last year on July 25th, 2021. Alliance and ICP households have had their eligibility extended until this month, July 2022. Our first renewal restart group will be Alliance and ICP beneficiaries with a August 31st, 2022 recertification end date. Alliance and ICP renewals will continue on a rolling monthly basis. 375 ICP renewals were mailed out on August 31st, were mailed out with an August 31st, 2022 recertification end date, and 2,776 Alliance renewals were mailed out with a August 31st, 2022 recertification end date. At renewals, Alliance beneficiaries are required to provide verifications for income and DC residency. Actually, I'm going to go back here. So the reason why Alliance and ICP renewals are restarting because it's a locally funded program. It's not related to Medicaid. The services do reflect Medicaid coverage, but since the district's public health emergency has ended, we're going to be resuming renewals for these programs. So there have been changes to Alliance and ICP eligibility requirements in the past 2 years. One of the bigger ones is that Alliance and ICP now follow MAGI methodology, which is used to determine some of our Medicaid groups such as childless adults, children, parent caretaker, and pregnant individuals. Applicants and beneficiaries will now be asked about their tax household and tax filing status. If taxes aren't filed, the applicant or beneficiary would be considered a non-tax filer. This change promotes parity between the Medicaid and locally funded programs. And another big change to the Alliance program is that it no longer has a resource test of $4,000 for a household of one or $6,000 for a household of two. So this is just an outline of the income scale for 2022. The income scale changes yearly based on the federal poverty level. So I'm assuming these slides are going to be sent out. This is great for this year, but make sure you check back in with us. We'll obviously send this information out to HBX so that you all have the most updated FPL levels for next year. Okay, another big change is that certification periods are going to increase to 12 months and the face-to-face interview is no longer required. Our August, let's cheer for that, yay! Our August and September 2022 renewal groups will be our last groups to have the 6-month period. They will need to recertify in April and March respectively. Effective for all renewals after October 1st, Alliance recertification periods, I said it again, didn't I? Periods will increase from 6 to 12 months. And once again, a face-to-face interview is no longer required for Alliance at recertification or initial application. Yeah, we're really excited for that. We're hoping that it promotes, continuous coverage and it will lead to just a smoother process. Okay, so a reminder, ICP certifications have always been 12 months and they will continue to be 12 months. And another big and positive change is that, I think this is a spelling error. Alliance and ICP beneficiaries can now complete applications, recertifications, and changes through the District Direct, not DirecTV, website and mobile app. So just an overview of the Alliance and ICP eligibility requirements. For Alliance, the individuals must be aged 21 years old or older. They must meet the district residency requirement. They have to have an income of or at or below 210% of the federal poverty level and must not be eligible for Medicaid or any other third-party health or medical coverage. For our Immigrant Children's Program, individuals must be aged 20 years or older, 20 years old and younger, meet the district residency requirement, have income at or below 319% if they're aged 0 to 18, and 216% if they're aged 19 through 20, and also must not be eligible for Medicaid or any other third-party medical or health coverage. So at renewals, Alliance beneficiaries are required to provide verification for both income and DC residency. Here we've listed verification types for both income and residency. So some examples for income: pay stubs from the last 30 days, self-employment, the most recent tax return, statements showing retirement income, disability income, or workers' compensation, pension or annuity statements, unemployment income statements. So for residency, we only need one form of verification, and that's required for all of our Alliance beneficiaries and ICP beneficiaries who are aged 20. DC driver's license identification card or DC-1 card, active lease rental agreement or rent receipt, utility or telephone bill, pay stub or earning statement issued within the last 30 days with the individual's name and District of Columbia address, a property tax bill issued within the last 60 days for property that's located within the District of Columbia, and a completed residency form. We really want to encourage our beneficiaries to provide their own verification, but if they're unable to, they can complete the residency form. And just to note that if a beneficiary has someone complete their residency form, they'll need to provide their own DC residency verification. Okay, so for the Alliance and ICP renewal process, renewal forms will now be sent 60 days instead of 90 days before the end of the beneficiary's certification period. So for example, our households who are due to renew August 31st, 2022 were sent a renewal form on July 1st, 2022. Okay, so converted cases are cases that have been transferred from ACs to District Direct. In order to be fully converted, the beneficiary will need to complete a conversion renewal form. Most Alliance and ICP households will use the conversion renewal form to renew benefits. To the right is a little screenshot of what the cover letter looks like. Alliance and ICP beneficiaries may submit their completed renewals online through District Direct. It allows for the beneficiaries to complete their renewals, report changes, submit verifications, and view notices. Once again, that website is districtdirect.dc.gov, or they can download the mobile app. Please encourage beneficiaries to download this app. It's a very useful tool. It helps them be self-sufficient in their healthcare insurance. It's a really great tool, and we want to make sure that our residents at least have the app, if not using it themselves. Or you can help them learn. I know somebody said they were not so tech savvy, but this is a really cool app that allows for them to complete the application, and I think it's a little bit easier online than on paper. They can complete it by phone through the call center, and a language and translations line is always available to our beneficiaries who need translation services. And they can always mail it to the Department of Human Services, drop it off at a service center, or fax it. District Direct is available online in English, Spanish, and Amharic. So today's materials will be on our DHCF website. The link is below for an Alliance ICP renewal FAQ. It just goes over what I discussed. You can share it with with residents so that they get a better idea of what the renewal restart will look like in the district. If you have any questions or concerns, we have a dedicated Alliance Research email address at dhcfallianceresearch@dc.gov. And if you have specific questions about the presentation, you can email myself at yemi.gata@dc.gov, or Danielle Lewis-Wright, the Associate Director for the Division of Eligibility Policy, at danielle.lewis-wright@dc.gov. Oh, any questions? Yes.
So I know before the pandemic, we could only submit an alliance renewal 7 days in advance of the date. Is that still the case?
So I'm going to repeat the question. They asked whether or not it was still the case that an Alliance research can be submitted 30 days before the renewal date. As soon as the Alliance beneficiary receives their renewal form, they can submit it. Yes.
How about if we miss the deadline? Then you can have like a 45-day grace period to do that process. Is that still the case?
You mean 45 days after or before?
Let's say I missed my deadline 8/30.
Mm-hmm.
And I remember September 15th. Can I still renew by then, or do I need to reapply?
You don't have to reapply. It's not, is it, Daniel? It's not 45 days, it's 30.
So if I miss my deadline to renew my alliance, do I still have a grace period of 45 days after?
Yeah. Okay, so just so we can repeat on the mic, if an Alliance beneficiary misses their renewal or doesn't submit by that final renewal day, they have 30 days after that to submit a renewal without having to complete a whole new application. So they would still need to complete that renewal. I'm here. Yep.
The mobile app and the website to connect the accounts.
Mm-hmm.
So being the case manager and working with a lot of our immigrant community, it has been hard for us to connect the accounts to connect into the Medicaid ID or member ID or preference ID.
Mm-hmm.
So we've assisted our students to call and obtain that number, but somehow it does not connect. And that number does not reflect anywhere in the notices that they receive, this is your Medicaid ID number and this is your account number. So is there a training that you can provide, or somebody specifically that we can reach out to?
I can take that back for that request. Well, Joanne is our training superstar.
Fall under us. Okay. So what you would
Yep. Or you
Thank
can email this, the DHCF Alliance Research at dc.gov email, and we'll be able to assist you.
Okay, I got a screenshot of that.
Share with you if that issue was raised. Good afternoon, everyone. I'm Danielle Lewis-Wright, the Associate Director for our Division of Eligibility Policy. So that issue was raised yesterday during our eligibility subcommittee. And so we have elevated that to our agency director for the DCAS administration. We are in the process of sending out a letter. We're drafting the letter. It will include the actual medical number to be able to log on. So until beneficiaries receive that revised letter, please call the call center. But I do want to just communicate and share with everyone that issue has been flagged and we have a resolution in place. We just have to mail out the letter with the number so that you all will be able to go online and successfully complete the renewal.
And I want to thank you also for adding the upload documents.
Yeah.
To upload documents right away after submitting the application.
I think I wanted to piggyback off that in that what I have found is even if we have the medical number for someone, it doesn't work. You need the PRN, the person reference number. So I think that's like a different IT fix.
Right, and what Danielle's spoke to, that's the number we're looking to ensure that it's sent out. That person record number, so you'll have it. Yeah. You're right on point.
Yep.
So for the income information, it's fine. Does that already start now, or is that going to be,
That starts now.
okay, got it.
So, somebody who is eligible for alliance. Oh, sorry. I have some people that are eligible for alliance because of their immigration status. But income becomes a problem. They have the DC, proof of DC residency, but they don't have any income. All I have done so far was send them to one of these ESA offices to see what could happen, because I don't know how to enroll them without the,
So are you saying
Income.
they don't have verification of income?
they don't have verification of income, and they are homeless.
Okay, so homelessness doesn't require a verification.
Of income?
No, homelessness can be self-attested. We just encourage that our homeless population provide a mailing address so that when we do send out recertification and notices, that they're able to receive them. In regards to income, if they don't have any income, then that is it's self-attestable in itself. But are you saying that they're receiving income and maybe they don't get pay stubs or?
No, they don't receive income.
Oh yeah, then there's no verification required for that. You would just report on the renewal or the application that they don't receive income.
Okay, thank you.
Oh, right behind you. Hi.
Oh, thank you. I'm sorry. I have a question in regards to the link for the renewals. I have been seeing like some consumer had to renew on the, like say on the 1st of July, but when we check on June, like the 25th, say like that, the link is not already in the district direct. And then if we check on the 1st of the month, like it says in the state system, will the link appear on the 1st of the month when the insurance is gonna end, or will it appear before now with all of these changes?
So let me make sure that I understand. You're saying that when you go into District Direct, you're trying to access the renewal link and it's not allowing for you to?
In some of the cases where like it's in the state system, it say it's gonna end like say on July. And it also say research date is like say July the 1st. But when you check in June, the link is not in there. So will it appear on the first of the month that the insurance is gonna end?
Juwan, do you know about that?
That is a special question right there, because I would have to see the case scenario to be
Mm-hmm.
able to speak more in depth about it, because if a renewal is due, it should allow you to be able to do that renewal. So it could be questionable with the date of ending, meaning that it may not be the time, but I would have to see that case.
If you don't mind sending a screenshot next time you encounter that and send it to the DC Health, DHCF Alliance Research email, and I can forward it to the appropriate team.
Okay, and I have another question.
Sure.
And this is in regards to the self-employment. In the slide, it says that the tax return is required. What happens, there are some consumers that they have like a statement from their accountant that is like for the middle of the year or for the quarter.
Mm-hmm.
Is that accepted as the?
Yep, you would just make sure that they are providing their accountant or whomever is providing that statement their contact information, so that if we need to follow up that we were able to.
Thank you.
You're welcome.
I have a similar question that I asked Purdy, but this time about an outreach plan for Medicaid unwinding. So in addition, if the extension does not happen in October, is there a plan in addition to sending letters to get the word out about Medicaid unwinding, and what support can sister organizations and other community-based organizations provide?
Yep, so we're hiring a communication contractor to help us get the word out. We'll absolutely be in contact with HBX and our sister partners so that we can spread the word. As soon as we know, we'll definitely let you all know. So just make sure that you keep you guys' eyes out on your email.
Thank you. And then, is there, this might be too early on, but is there a plan for additional outreach for consumers who can't be reached? So for example, if we have a panel of Medicaid beneficiaries and you all are not able to reach them, is there a plan yet for that, or is that something that's still being developed?
Yeah, we're still in the works with that.
Okay, thank you.
Thank you. All right. Thank you.